in biochemistry from Queen Mary. He has a master's from analytical chemistry from King's College. And he has a BDS from Bath and the London Medical Dental School. He's a dental surgeon. He's loaded. And he's just, the man for the hour tonight. We'll be talking about dental health. And I am sure you'll be glad you came tonight. Join me even as I welcome Dr. Olatunde Fasanya to the podium. Please give a hand to Jesus. 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 You're welcome, sir.
Good evening, church. So, my name is Olatunde Fasanya. I'm a general dental practitioner. I work down in Crayford. So, this is my first year of qualifying. I finished summer last year. So, when you finish dental school, you have to work for the NHS for a year. It's compulsory. And then afterwards, you can do what you like, whether go to hospital, stay in NHS, or go into private clinic. So I'll be talking about oral health tonight. And by a show of hands, in the last 6 months, how many people have been to the dentist? Okay. So ideally, everyone should visit the dentist at least twice a year. Well, if not twice a year, at least once a year. So well done to people that have gone in the last 6 months. And hopefully you went for a checkup, not just when you're in pain, which is what most people tend to do. They tend to go to the dentist when they're in pain. And the thing I say to patients is, your teeth is like a car. You don't wait for your car to break down. You have to do MOT and servicing every year. And most people take their teeth for granted. People will stay with dental pain for months and months on end because they've got dental phobia, which sometimes is legitimate, but most other times it's just conditioning of the mind, saying that, oh, the dentist is going to hurt me. But truly, the dentist is not there to hurt you. No one wakes up in the morning trying to think, who can I inflict pain on today? It's not strictly true. So I would advise everyone to go to the dentist regularly. Next slide, please. So the World Health Organization defined oral health as being free of chronic mouth pain and diseases. The word health in itself, it's not an absolute term. You can have illnesses and still be healthy bodily wise. Same thing with your teeth. There could be things wrong with your teeth, but still able to function normally. But there are some issues that arises that causes the mouth to not function properly. Mainly people who have got oral cancer and periodontal disease, which is just gum disease, and also people that are born with cleft palates, like they've got holes at the roof of their mouth. And basically what we want to maintain or achieve is that nice smile over there, probably not as white as that, but healthy teeth. Some people are towards the middle, where their teeth are not so great, they've lost bone and their gum is receded. And that's what we don't want to end up at, having dentures later on in life because we've neglected our teeth, which is not good, because when you have dentures, although people can function, you can eat, but it's not as good as having your own teeth, because what God made, there's no substitute for it. Next slide, please. So most things that give people pain are teeth, but well and truly, our mouth is made up more of soft tissues. So the roof of the mouth, the tongue, and your cheeks cover a lot more surface area than the teeth. But the most bit that cause concern are our teeth. Next slide, please. So with regards to what causes most diseases, which is our teeth, the thing is, if everyone watch what they eat and through basic oral hygiene, literally, I'll be out of a job. There would be no reason to have a dentist, apart from those that work in hospital that deal with mouth cancer and like people that deal with severe illnesses or malfunction of the mouth. Because generally, if you think about it, our forefathers, they didn't have any dentist. And the main reason why people have holes in their teeth is because of sugar, literally. If you cut out sugar in your diet, apart from abnormalities when you were born or your genetics, if there's any malformation, apart from that, there shouldn't be any reason to have holes in your teeth. We've already touched on going to the dentist twice a year. So it is recommended to brush twice daily. And people tend to just brush in the morning. But the thing is, the most important brushing is before bed, not actually in the morning. The reason why people tend to brush in the morning is because they don't want their breath to stink. But the reason why we advocate brushing at least once during the day, we're meant to brush twice a day, but if you have to brush once a day, if you don't have time, it's better to brush at night, because when you sleep, you have reduced saliva in your mouth, and saliva coats your teeth. It helps against tooth decay. So brushing at night and leaving the toothpaste on your teeth helps protect the teeth whilst you're sleeping, and then you can brush in the morning or any other time during the day. But if you don't want your breath to stink, it's advisable to brush in the morning before you leave for work. And also, people ask, do you brush before you eat or after you eat? Generally, there's no difference whether you brush before or after you eat. People just don't like the taste of not brushing before eating. But if you eat, you have to wait at least 30 minutes before brushing. Because when you eat, your teeth are slightly soft, and then if you brush immediately, you're wearing away the top surface of your teeth, and that's how people end up getting sensitivity later on in life. So it's probably better to brush before you eat if you don't have time to wait after eating in the morning. Next slide, please. Okay, so we're just going to go through basic oral hygiene. Most of the patients I see, they say, okay, I know how to brush. But then when you ask them how do they actually brush, then you realize that they're doing it all wrong. So when you get home tonight, if you flip your toothpaste over, you'll see something that says fluoride concentration. It's either NaF or just fluoride or just F. And it needs to be at least 1,350 parts per million. So that's the whole reason of using toothpaste, apart from keeping your breath fresh, is because of the fluoride in the toothpaste. The job of the fluoride is to coat your teeth and to strengthen it against tooth decay. Because when you're eating, the bacteria in your mouth break down all the food you're eating and they produce acid, and that's what causes cavities in your teeth. But the fluoride actually goes into your teeth, forms a complex, and helps it against tooth decay. And also, for children, there are age-specific toothpaste. So it's not advisable to use adult toothpaste for kids because they still have teeth developing in the jaw. And if you have a higher concentration of fluoride, you can actually affect the way the teeth develop, and then the teeth can come out, or they could end up getting something called fluorosis. So the teeth come out discolored or have white patches on them. So that's why for kids up to the age of 3, it's advisable to use toothpaste that's got 1,000 parts per million on it. And then it's just a tiny smear that you put on the toothbrush. And then from the age of 3 to 6, they can still use 1,000 parts per million, but it has to be half a pea size. And then after that, they can use normal, after the age of 6 years old, they can use normal adult toothpaste. And also, advise patients to, once you finish brushing, don't rinse your mouth out. Because if you rinse with water, all the fluoride you used to coat your teeth, you just washed it all away. So you might as well not have brushed in the first place. It tastes a bit funny for about a week, but you get used to it. It's advisable not to rinse, just spit out. Some people say, oh, but I still got the dirt in my mouth. I would say, oh, once you brush first, you can rinse and just get a bit of toothpaste and just apply it all over your mouth. It helps strengthen your teeth. And also, it's very advisable to use interdental cleaning. So on the top hand side, those are called flossets, A lot of people find them easier to use than a normal floss tape because they don't know how to put it in between their teeth. So the way I explain it to patients is your toothbrush only brush the top surface, the outside and the inside of your teeth. It doesn't cover in between your teeth. So you need to floss to get all the dirt out of in between your teeth. So it's very important to use dental floss. And also, because I remember when I was growing up, we didn't change our toothbrush that often, maybe twice a year. But it's advisable to change your toothbrush every 3 to 4 months, or when you see the bristles starting to splay. If they're not standing erect, then they're not useful. You need to change it. And then also, people that use electric toothbrush, just change the brush head every 3 to 4 months. For electric toothbrush, the way you know when to change it is if the colors of the bristle starts fading. That's when to change the brush head. Next slide, please. So this is what I was talking about earlier about how to brush your teeth. A lot of people just take the toothbrush and they just go front to back, front to back, front to back, sideways, which is actually wrong. Because if you're doing that, you're not actually cleaning your teeth, you're just moving the dirt from side to side. What you need to do is get the toothbrush for your top teeth, turn your wrist slightly upwards so the bristles engage in between the gum and the tooth, so at a 45-degree angle, and you do circular motions, just little circles. So it goes in and out and cleans in between your teeth and the gum. So a lot of people are very good at brushing teeth, but almost the whole population are terrible at brushing between tooth and gum, which is where you get all the dirt trapping because there's a little gap between your tooth and gum. So if you're just drawing sideways, all you do is just moving it side to side. But if you're brushing in a circular motion, the bristles goes in and comes out. It goes in and comes out. So that way, circular motions remove the dirt between the gum and the tooth. And also, it is advisable to brush for 2 minutes. That's for adults that have got a complete set of teeth, that have got at least 28 teeth in the mouth. But for kids, there's no need to brush for 2 minutes because they don't have enough teeth to last that long for 2 minutes. Just a minute will do, or a minute and a half will do for kids. And what I tend to tell patients, they're like, oh, I can't really tell when it's 2 minutes. For people that have got electric toothbrush, it vibrates every 30 seconds. So once it vibrates 4 times, then you know the 2 minutes is up. But for people that don't have electric toothbrush, it's either, I'll tell them, like, play a song. Average song lasts about 4 minutes, and everyone knows when the midpoint of their favorite song is, so you can stop brushing at that point. Or you can get a little egg timer. They sell it at £1 shop. That's for 2 minutes. Just turn it, and then once it finishes, you know that's you done. Next slide, please. So looking after kids' teeth, a lot of new mothers in the church get worried when they see their kids' mates having teeth around 6 months, the 2 lower teeth coming out first. The thing is, it's an average. So some babies are actually born with teeth, and it can take up to a year for the first teeth to appear. It's not much of a worry if your child has delayed eruption. You only tend to worry if they don't erupt in the right order. So once the front 2 teeth, lower teeth, usually come out first. Once they come out, then I advise to take your child to the dentist just to have a look, make sure everything's okay. Otherwise, you can just start brushing normally. And what I tend to tell parents is that when kids are very hard to brush for, you can buy little finger props that you just put on your index finger and just quickly brush their teeth instead of using an actual toothbrush. Next slide, please. So a lot of people ask which one is better, electric or manual toothbrush. And the honest truth is there's no significant difference. It's just a way of companies making money and being fanciful. Because if you're actually brushing properly, there's no need for electric toothbrush. Electric toothbrush only came about because of orthopedic patients that have got wrist problems and people that have got severe arthritis in their wrist that they can't actually brush properly. So they just hold the toothbrush against your tooth and the brush head does the job. But if you're brushing properly, there's no need. But one category of people that I recommend electric toothbrush for people that have got gum recessions. You know, a lot of people tend to really, really have a go at their tooth, brushing really hard, and then the gum starts moving up, and then you start seeing the roots of your teeth, which can give sensitivity. So if you buy electric toothbrush, if you're pressing too hard or you're brushing too hard, it either vibrates more or it flashes, then you know you're brushing too hard. So those are the two categories of people that would really benefit from electric toothbrush. But everyone's welcome to buy one if you want to, but as long as you're brushing properly, there's no need to buy an electric toothbrush. So with regards to diet and tooth decay, it's mainly sugar and acidic food that causes tooth decay. I know like doctors and GPs and nutritionists, they will tell you that having fruits is good for you. But the thing is, in dentistry, having too many citrus fruits is bad for you because it actually is very acidic and it wears down your teeth. So people that do juices that just process fruits in the morning and drink it, because the thing is, when you do that, the sugar is readily available and it just attacks your teeth. So I would say for people that do that, it's good, it's healthy, but if you want to do that, use a straw, because when you take it through a straw, it just goes to the back of your throat. It doesn't settle on your teeth. And also, when you finish having your juice, just have a drink of water just to wash away the sugar on your teeth. And also, in order to prevent tooth decay, you're only allowed 4 sugar attacks a day. So that means breakfast, lunch, dinner, that's 3 sugar attack. And then one more snack or anything to drink. So people that sit in, especially people that sit in the offices, they've got sweets on their table and they just nip on it one at a time, and then 10 minutes later, take more, eat it. It's actually better to eat a whole pack in one go than to break it up if you need to have it. Because if you break it up, having little by little is the same sugar attack as having a whole pack. I'm not saying buy a whole pack 4 times during the day. That's wrong. I'm saying if you want to have it, have a whole pack in one go instead of breaking it up during the day. Because once you eat something sugary, the pH in your mouth drops, and that's when it's acidic, and that's what causes holes in your teeth. And it takes about 20 to 30 minutes for the saliva in your mouth to buffer up again to neutralize the acid. So imagine you have sweets now, and then 30 minutes later, you have another sweet. Before your mouth neutralizes, you dipped down into acidic environment again, and that's how you end up having holes in your teeth. And what I say to parents is, they say that, oh, I need to give my kids snacks just to keep them quiet. The thing is, what they don't know, they won't miss it. So when they're little, it's actually better to make them think that healthy food is a good treat. So when they do something that's pleasing, I'll just say give them fruit instead of giving them sweets. And also, if they need to have snacks, just give them cheese with plain biscuits, because there's no sugar in those, or just plain crisps or vegetable crisps. That's better than buying all this processed food that's just full of sugar. Next slide, please. So for tooth decay to happen, there's 4 things that's needed. Time, which is if you're continuously eating sugary food. You've got bacteria in your mouth. So we've got bacteria in our mouth, which are good bacteria because they stop all the bad bacteria infecting our mouth. And then you've got sugar, and then you've got tooth. Out of all of those, the only thing we can control is the sugar. So if you knock off one of those things, you significantly reduce the chances of getting cavities. So if we cut down the sugar intake, that's really good. And a lot of people tend to have a lot of sugar in their tea. Some people drink tea like 4 or 5 times a day with like 2 teaspoons of sugar. What I tell people is, if you say that you're going to cut it immediately, it's not going to happen. You just have to wean it, because it took years for you to build up your tolerance. You just have to wean yourself off of it slowly. So this is what I did, and it worked for me. So if you normally have a teaspoon of sugar in your tea, what I would say is for a week, cut to half a teaspoon, and then the following week, cut it to a quarter, and then the following week, don't use it at all. So within a month, you can literally stop having sugar in your tea and coffee, and your brain will gradually adapt to it. Next slide, please. So the other issue with people is gum disease. Because a lot of Afro-Caribbean people, they believe that they've got dense bone. They'll be like, oh, when I went for tooth extraction, it took the dentist a long time to take my tooth out because my bone's very, very hard. Strictly speaking, not really true. But the reason why a lot of people get gum disease is because when you're eating and you're not cleaning between your gum properly, all your food debris are there. The bacteria in your mouth break it down. They release toxins. The toxins are not meant to be in your mouth, so your immune system pushes blood and immune cells towards your gum to fight the disease. That's why when some people brush their teeth, they say, oh, my mouth is bleeding. I can see blood. What I tend to tell patients is, and then people tend to stop brushing in that area because it's quite painful. But the thing is, if you neglect that area, it's just going to get worse. So what I tend to tell patients is that brush generally and stop and keep flossing. It's a case of it's going to get worse before it gets better. So the more you brush it, it might bleed a little bit more. But over a week or so, it should settle down. So the process of your gum getting inflamed, getting puffy, and your body resolving the issue, getting puffy again, resolving the issue. So the bone in the area starts shrinking down because the toxins are impacting the bone. So the bone starts reducing, and then that's when you start losing bone in your teeth, and then your teeth become wobbly, and then over time, you lose teeth, which is a shame because there's no reason to be losing teeth to bad oral hygiene, because oral hygiene is really simple to maintain. It's better, prevention is better than cure. It's better for you to brush properly and look after your teeth than having to replace teeth in the long run, which is not beneficial. Next slide, please. So this is the other main issue that people present with. A lot of people, they complain that in the winter time, when they're walking in the street, their teeth are very, very sensitive and it's painful when it's cold, or they can't eat anything cold. Main reason is because when people are brushing too hard, their gum shrinks down and the roots of your teeth are exposed. And the thing is, the top layer of your tooth, which is the enamel, which is quite strong, doesn't cover the roots of your teeth. And your roots of your teeth, the roots of teeth, they've got small channels where when you have something cold, it just goes in, and then that irritates your nerve, and that just, when you get the sharp shooting pain in your brain. And the most effective way of dealing with this is by using Sensodyne toothpaste. They're very, very effective at blocking those channels. And what I tend to tell patients is when you finish brushing, like I was saying, don't rinse, because there's particles in the toothpaste that block the channels on your teeth. That stops the sensitivity. And just get a tiny bit and just rub it all along your gum overnight to block it. There's no true treatment for sensitivity. You just have to manage the symptoms, because once you have sensitive teeth and you've got receded gum, unless in extreme cases where they have to do gum surgery, where they remove gum and then cover it back up again, most people just tend to deal with it by just using Sensodyne toothpaste. And I think that's the end of the presentation, just a brief stop on oral hygiene. And anyone got questions? Oh. The mic is not working. Oh, I don't know, it's up to you. Is it working? Yeah.
Hello? Can everyone hear me?
Yeah.
Okay, great. First of all, I just want to say thank you, because I really think a lot of the stuff that you said, I had a little bit of insight because I had an issue, I had a really big issue with gum inflammation last year, and my dentist kind of changed my whole routine and everything. He made me buy a lot of stuff. I just wanted to ask about Corsadil and what your thoughts are on it, because I've been using it because I had a gum disease or inflammation or whatever. And I kept getting the blood and stuff like that. And what do you think about that? Is that advisable to use?
Yes, Cosodil is very good for bleeding gums. So there's Cosodil toothpaste and Cosodil mouthwash. The thing with Cosodil mouthwash is it stains your teeth. So I would say don't use it for more than 10 days in a month for Cosodil mouthwash. It's not the actual mouthwash that stains your teeth, but the food you eat. If you eat colored food, it just sticks onto your teeth. So it's not the actual mouthwash, it's the food that you eat that stains your teeth. But don't use it for more than 10 days in a month. And buy Cosodil toothpaste is quite good.
Okay, we'll just take here and 2 here.
Can you just advise me on sensitive toothpaste? Because I've used some brands that actually increase the sensitivity that I have, and there are some that have tooth whitening products inside that do seem to be slightly effective, but I just wanted to know why some of them actually cause more sensitivity. And also, teeth whitening products, I've bought one that has a gum guard and it has a gel that you put on and a laser. Because sometimes they're really expensive, so I just want you to advise me on if they're good. And the last is sugar. I know that it's probably not advisable to eat sugar at all, but there are some, new plants and stuff like stevia and natural sugars that are replacing cane sugar and things like that. So if you could just advise on that, thank you.
Yeah. So the first one about sensitive toothpaste. Different companies have different components in the toothpaste, but the most one that I've seen that's most effective is Sensodyne. Rapid Relief is the new one they just brought out like a few months ago. That's quite good. Some people like Colgate. You just have to find what works for you in terms of sensitive toothpaste, because different people react to it differently. So you just have to buy different ones and see which one works. And with regards to teeth whitening, I would stay clear of buying stuff online, because when you buy the stuff online, you don't know, even though they say the concentration of the hydrogen peroxide in it, but you can't guarantee where they got it from. And a lot of people tend to go to beauty salons to have their teeth whitening. Is actually illegal, because people that are not registered with the General Dental Council are not meant to be providing teeth whitening treatment. And also, all those ones that you buy in Boots for like £30, £40, they're useless. They're just taking your money. So if you want to whiten your teeth, I would say go to your dentist and get a proper mold of your teeth and have proper gels, because they will tell you how to use it as well. So if anything does go wrong, at least you've got a dentist to go back to. But because a lot of this stuff is quite acidic, and they can really damage your gums. So I would stay clear of buying off the market things. With regards to natural sugars, it's still sugar at the end of the day. So it's just most sugars are still gonna have an impact on your teeth.
All right. Please, let's do it this way. I'm going to take 3 questions. You ask them together, and then he can answer you together. Now, Dr. Fasonya is available. You can only speak to him behind if you have any further question. Agreed? All right. I will take 1. Oh, okay. 1, 2, and 3. No, I've taken 2 there. Sorry. Please ask him after, please.
Thank you very much for the presentation. I have 2, not questions actually, but observations which work very well for me. The first one is about not having to rinse your teeth after brushing. My husband told me earlier, Clement, that you had a session with them and you sort of enlightened them on how to brush teeth and all that. So I tried for some few times without rinsing my teeth. But on second thoughts on hygiene reasons, I decided to experiment. So I'll brush, rinse very well, then just now take a small pea-sized toothpaste and brush again. So that way I leave fluoride on my teeth and I feel better because I don't have a bad breath. Praise God. And the second observation to make is about, bear with me now, I haven't lost my line of thoughts. Yes, about using Sensodyne for sensitive teeth. I used Sensodyne for many years because of due to sensitivity. But after a while, I noticed that I was sort of having a bit of residing going and all that. And I was using it for my growing daughter. She's now an adult. And because she was not exposed to a lot of sugary food in schools, that had a detrimental effect on her tooth enamel, which began to eat away. And that led to her first fillings. And the dentist sort of said that the fluoride level in the Sensodyne was so low. So because of that, I stopped using Sensodyne and switched to fluoride-based toothpaste. Praise God.
Praise the Lord. Please, your question should not be more than 1 minute, please.
Hello, doctor. My question is a real life story. Yeah? Let me just put it straight away. What I mean is that if for the aging generation, if you have one of the molar or premolar being taken off from your teeth or something like that, what is the disadvantage of it if you don't actually replace it?
Okay, so what happens is if you don't...
replace any of the molar or the premolar in your
teeth?
Yeah.
So what happens is when you... Because the roots of your tooth, they are like roots of trees. Roots of trees, they actually hold the bone in place as well. So if you take your tooth out, there's 3 options. You can either have a denture, which you put in and take out, or you have a fixed bridge, so they stick on another tooth. It's like a fake tooth, but it's stuck onto your teeth. You don't have to keep taking that one out. But the best option is an implant, but it's available privately, and they're about £2,000 for one tooth. So the implant, which is the best option, is like it's a screw that goes into your bone. That holds your bone in place. It stops your bone going down. Because when you take tooth out, you realize that over time, the bone goes down. So if you don't want to have implants, the best thing is to have a denture or a bridge. Because if you imagine, if there's a gap, so teeth help keep tooth in place. If there's a gap, the tooth either side is going to cave in. So they fall in on each other. And the one at the top erupts into space. And it can mess up your occlusion, and you can end up having joint pain. So I would say once you've taken the back teeth out, after about 2 to 3 months, the bone will settle initially. Then you can go back to your dentist, and you can talk about the options for replacing the gap.
Okay, praise God. I want to ask you, can you, from your own professional opinion, can you advise on any foods one may eat or any service that one may be able to get to reverse receding gums? Is it possible?
The thing is, once you lose your gum, it doesn't grow back. That's it. Pretty much. Unless your gum is really, really receded, and then your dentist will send you to the hospital, and they can do a gum graft. So they take flesh out of the roof of your mouth, and then they replace it. They graft it onto your tooth surface. But once your gum goes down, it doesn't grow back. That's it.
Hey, yeah, so on one of your slides, it said that you shouldn't use mouthwash after you brush. So I want to know, when do you use it?
Oh, yeah. So, sorry, I must have omitted that. So it's not advisable to use mouthwash after brushing, because the mouthwash has about 250 parts per million fluoride, whereas your toothpaste has got at least 4 times that. So if you brush your teeth and you rinse with mouthwash, you just literally washed everything away. So it's better to use mouthwash maybe after eating lunch, just to freshen your breath, because otherwise there's not really any health benefits to using moist mouthwash apart from cosmetic reasons. Just have fresh breath. That's it, really.
Praise the Lord. Please give Jesus a hand. I'm not. Amen. I know there are several hands up there. I saw your hands, but if I'm to take everybody, time is fast spent. We still have so much to take today. So please